Here are the most common treatment options for pleural mesothelioma and more details about each. Surgery is one of the main treatment options for pleural mesothelioma depending on the stage of cancer. For early-stage mesothelioma, stage 1 or 2, surgery may be performed to remove part of the lining of the lung, parietal pleura, or lining of the lung and part of the lung, pleurectomy/decortication. For some patients, surgery to remove part of the diaphragm or the whole lung may also be considered. The goal of surgery is to remove as much of the cancer as possible. However, mesothelioma often returns even after surgery, so it is usually combined with other treatments. Extrapleural pneumonectomy, EPP, is an aggressive surgery for mesothelioma that removes one whole lung as well as the lining of the chest wall, diaphragm, and pericardium. EPP is a complex surgery with significant risks and side effects including lengthy hospital stays, possible complications, and reduced quality of life. Recent research suggests EPP does not provide a significant overall survival benefit compared to less extensive surgery and non-surgical approaches. As a result, EPP is now used less often for most mesothelioma patients. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells and shrink tumors. For pleural mesothelioma, radiation therapy is usually given along with chemotherapy and may be used in different situations. As adjuvant therapy, after surgery, to kill any remaining cancer cells and reduce the risk of recurrence. Radiation is usually given after EPP or extended pleurectomy, decortication. For palliation to relieve pain or other symptoms from advanced mesothelioma tumors pressing on vital organs or structures. Combined with chemotherapy as part of tri-modality therapy before and after surgery for potentially long-term control. For recurrent mesothelioma after previous surgery or disease that was not removable with surgery. The most common types of radiation therapy used for mesothelioma include intensity-modulated radiation therapy, IMRT, and particle beam radiation therapy such as proton beam therapy. Radiation is usually given in short, daily sessions over several weeks. Side effects may include fatigue, skin irritation at the treatment site, and rarely lung inflammation. Chemotherapy uses anti-cancer drugs to destroy mesothelioma cells. For pleural mesothelioma, chemotherapy is normally part of a multi-treatment approach along with surgery and/or radiation rather than a standalone initial treatment. Several types of chemotherapy drugs may be used in combinations for mesothelioma including platinum-based drugs, cisplatin and carboplatin. These are currently the most widely used chemo drugs and backbone of most mesothelioma treatment regimens. Pemetrexed, Alimta, a newer chemo drug approved as a first-line treatment for mesothelioma based on its ability to help control the cancer and extend survival compared to cisplatin alone in clinical trials. Pemetrexed is often given with cisplatin or carboplatin. Gemcitabine, usually combined with cisplatin, this chemo drug has also shown effectiveness against mesothelioma. Pleurodesis, a newer alternative to pemetrexed as a platinum-based chemo option. Chemotherapy for mesothelioma is usually given as infusion or injection through a vein, on an outpatient basis, most often every 3 to 4 weeks. Common side effects can include fatigue, nausea, vomiting, reduced blood cell counts, mouth sores, hair loss, and increased risk of infection. Managing side effects is an important part of chemotherapy treatment. Pleurodesis is a procedure that helps prevent accumulation of fluid around the lungs, pleural effusions, which is common in advanced pleural mesothelioma. It involves using chemicals, medications or other techniques to intentionally scar the pleural surfaces so they grow together and the space between is closed off. Talc pleurodesis, which involves instilling talc into the pleural cavity, is commonly used. Other options include using doxycycline, bleomycin or immunotherapy drugs. The goal of pleurodesis is to prevent fluid buildup and reduce need for frequent drainage procedures, thus improving quality of life. However, it does not treat the cancer itself. Some newer targeted therapies and immunotherapy drugs are also being studied in clinical trials for treatment of advanced mesothelioma with the potential to provide alternative options to chemotherapy. These include immunotherapy drugs like nivolumab and other checkpoint inhibitors, anti-VEGF drugs bevacizumab and ramucirumab, and multi-kinase inhibitors like nintedanib. Results have been promising so far, but ongoing research is still needed to determine their full roles and effectiveness against mesothelioma. Participation in clinical trials is strongly advised when possible. In addition to the medical treatment options above, multi-modality disease management of pleural mesothelioma also involves palliative care to relieve cancer-related symptoms and improve quality of life. Palliative care may include pain management, nutritional support, breathing exercises, counseling and other supportive care services to reduce suffering for patients and their families. Making decisions about treatment often involves weighing the pros, cons of any proposed therapy versus palliative care options as the goals shift from cure to extending lifespan and comfort. This covers many of the major treatment approaches used for pleural mesothelioma based on the latest research evidence. Management is complex and varies by the individual case and stage of disease. A multidisciplinary care team approach is important to determine the best possible treatment plan for each patient's situation. Clinical trials remain the best option whenever possible to test new therapies for this challenging cancer.